Hi, it's the nursing professor, and it's Professor Jones, and we're doing the respiratory system today. And the respiratory system is responsible for gas exchange in your body. We don't normally think about that's what you're doing when you're breathing, but it really is gas exchange. You're inhaling oxygen and you're exhaling CO2, which is the waste product of the oxygen that you breathed in. So what's comprising your respiratory system is your nose, your mouth, your throat, your voice box, your lungs, as well as your diaphragm. So what's going to happen is when you breathe in the oxygen, it goes down into your lungs, into the bronchi, the bronchioles, and the alveoli, and is pushed into the capillaries, which then take the blood into your tissues. And so your different organs in your body are able to get the oxygen that they need. Once it's used up, the oxygen is used for energy, the CO2 is left. And the CO2 is what you exhale. It comes out of your mouth when you exhale. So that's the gas exchange that happens in your respiratory system. So you got to also think about it. If you weren't able to bring in air through your nose, you wouldn't be able to smell. When you breathe in the molecules, it passes over your olfactory nerve, which allows you to detect smell and determine what that is. You sends messages to your brain, and oh wow, that smells like fresh baked bread or whatever you're smelling at the moment. It also plays a very important part in acid-base balance, which for nursing students is like a dirty word because that's always the least favorite topic of most people is acid-base balance. But it starts, it's going to go with the respiratory system because, again, we just talked about the gas exchange. So your cells need oxygen to create energy, which is why you have to breathe. And so I think we talked about this in the vital signs, the normal rate for breathing is usually anywhere from 10 to 20 breaths per minute in a person. So that's how much oxygen you're bringing in, like you're inhaling oxygen at least 10 to 20 times per minute. And then you're exhaling the CO2. So if you think about, we did that. The air goes in through your mouth and nose. It goes into the trachea, down into the bronchi and the bronchioles. And then it reaches the alveoli. It's pushed into the small vessels, the capillaries, and then goes into your tissue, into the tissues of your body, providing the oxygen that's needed. And then the waste product is the CO2. So you think about it, your nose and your mouth also have protective features, as well as there's little tiny hairs called cilia, or little, tissue that acts as a way to trap things that get in. So if you think about it, sometimes you inhale something and you immediately want to sneeze, and that's a protective mechanism so that you don't inhale something that shouldn't end up in your lungs. So there's protection in there as well. Some of the conditions that you can see that go wrong with the respiratory system is allergic rhinitis, which this is the season. So people have allergies, and it ends up with the sneezing and, feeling irritation in the nose, and it can go down into the lungs as well. An upper respiratory infection, which is a fancy word for a cold, asthma, COPD. Anything causing inflammation can make you have pneumonia or bronchitis. You can have sinusitis. It just depends on where the inflammation is in the respiratory system. Interstitial lung disease, which basically it creates scarring in the lungs, so that the lungs are not as pliable, so they're not able to inflate and deflate as well as they normally would because there's some scarring there. Also, we talked about the acid-base imbalances. So if you exhale too much or too little CO2, you throw the acid-base balance of your body off. So those are some of the things that you can see wrong with the respiratory system. So one thing to remember when you're assessing somebody's respiratory system, a good mnemonic to remember is PIPA. So PIPA is P is for positioning. Ideally you want the patient to sit upright. You can listen to lung sounds the best in that position. I is also inspection. So you want to inspect the chest. Is it symmetrical? Is it even? Rise and fall of the chest as they breathe. Do they have a barrel chest? You're looking for signs of anything that could be wrong. Palpation, you also want to feel to see if you feel any growths or any crepitus, which would mean that there is subacute air up underneath the skin. Percussion, you're going to percuss to make sure you don't have dull sounds, which would indicate that you might have some fluid in the lungs, as well as auscultation, which is the main thing that most of us think about when we say assess the respiratory system. When you auscultate, now I don't want y'all to laugh at my drawing. I'm not a Picasso, But, and this is not to scale, but as you see, because it's not even, but this is the way you want to do it on the back of the chest. You always want to compare lung sounds from side to side, because that will help you pick up if there's something going on one side of the chest versus the other. So you would auscultate here and then compare it on this side, then go down. You're going to do here and then compare it on that side. You just keep going in like a zigzag fashion until you've done the basis of the lungs to listen to make sure you don't hear anything. What are you listening for? Well, you're listening to so that you can hear normal breath sounds. You kind of have to keep listening to lungs to kind of just understand and get in your mind what's normal. What's abnormal is stridor, and that usually that would happen on inspiration, and that would indicate some type of obstruction. Rails sound like fine crackles. It's almost like as if you took hair and rubbed it together. It's really a fine sound, and that usually means that there's some type of fluid going on. And wheezes can be heard on expiration or inspiration, and that is usually coming from bronchoconstriction or some type of inflammation, or like even a pleural rub. Those would be things that are abnormal. Or rhonchi. Rhonchi is kind of like just a heavy. I'm the worst with trying to explain what breath sounds sound like. It's better to actually listen to them so that you can hear it. So you're listening with the diaphragm of your stethoscope. After you did the PIPA, so you've done the positioning and all of the things we just discussed. Some of the diagnostic tests that you can expect to be ordered for a patient that we are concerned they have something going on with their respiratory system would be a chest x-ray. We've also helped to assess by looking at an O2 sat. They can also do pulmonary function test as well as ABGs. If they're really not looking well, then you would see them order ABGs to see what's going on with the arterial blood gases. Some of the nursing diagnoses that would be associated with the respiratory system would be ineffective airway clearance, impaired gas exchange, and that could be like related to decreased lung compliance, depending on what's going on with the patient, risk for aspiration, ineffective breathing pattern, as well as anxiety. Anxiety is a big one if you're talking about someone who's having trouble breathing. They're usually very anxious, which also doesn't help the whole situation, because anxiety is just going to put them on a loop of, I can't breathe well, and then, they're thinking about it. So anxiety is a big one for respiratory system problems. Then there you go. There's the respiratory system in a nutshell.